My name is Sara Tennant. I'm 38 years old. I'm a registered nurse for a little over 16 years, mom to 3 girls, and have been overweight the majority of my life. So before surgery, I've tried multiple diets. I've done everything you can imagine, from fad diets to, Weight Watchers or things like that, but nothing ever sustained. So I never got that long-term weight loss. I'd lose 30 or 40 pounds and then gradually I'd regain it, and you kind of give up and then you start over. And so I did cyclic yo-yo dieting for years. Some of the things that I had with being overweight for such a long duration, I've been overweight a good amount since probably my teen years and up. And so my entire adult life I've been pretty overweight, definitely in the obese category, morbidly obese prior to surgery. I have an old back injury that likes to flare up. And that was the final straw for me. I had a flare up earlier in this year. When that took me out, while I was out, I said, this is it, I'm done. And so I called Dr. Datta then. We kind of talked through like all the things I've gone through, all the challenges that I've had over the years. And we decided that having a vertical sleeve gastrectomy, or VSG, or sleeve, however you want to call it, was appropriate for me at my size with the comorbidities that I have. And so from there, it starts a very rigorous program where you go through a lot of different channels and a ton of preparation for the surgery. They get you very ready for what is to come. You go through a lot of different channels, and they actually give you this really cool binder, and it explains each phase. It explains all the things you need to do, whether it's cardiac clearance, there is psychological clearance, there's classes that they like for you to attend, you have labs that you have to do, you have to go through medical weight loss with their nurse practitioners and their staff. They teach classes in the office, there's nutrition classes, there's a nutritionist. So there's a lot of things. It encompasses everything, and they prepare you for every step of the way as you go through. And so by the time you get to surgery, you know everything about everything that's going to happen. So you're ready for pre-op, you're ready for your procedure, your surgery. You're also ready for post-op. You're ready for the changes that are going to happen. You're looking forward to what your diet looks like in the coming weeks, the coming days. And they support you all the way through that. And so it was wonderful to have that education around knowing what you were going to do, because it's a whole lifestyle change. You're not just going to lose weight and then you go back to whatever you're doing. It's not like that. You're going to change your entire life. Your anatomy completely changes. So you have to follow their program in order to be successful. Going through the program and going to see Dr. Datta and his team, they're so open. They lay out options for you. They tell you everything you need to know. Not at any point do you feel like, oh, well, you need to have surgery because you're morbidly obese. It's not like that. It's an inviting environment for you to feel safe. Being overweight is not a safe place. Never has been, never will be. It's just not. He is the most talented surgeon I've ever seen in my life. He is incredible. His bedside manner is incredible. He's a good human being. And that makes all the difference in the world. All the difference in the world. And I really appreciate that he chose bariatrics, because then I got to have a safe surgery. And that was extremely important to me. I feel like this has been a wonderful experience. It has been very smooth. And it's gone better than I think in my mind it was going to go. I thought that I was going to struggle a little bit more. I thought that I was going to have more challenges than I have. But it has been by far one of the smoothest experiences I've ever had, and one of the smoothest surgeries I've ever had. And I've had a number of surgeries over the years. And this one was by far one of the easier ones.